who is the founder and CEO of the Longevity Center and also the International Institute of Longevity. And I think you're going to be speaking about the work that you're doing in the clinical and also consumer space. So if I share your presentation.
Super. Thank you very much, Richard. Thank you, Svetlana, for organizing this conference and for having us here. My presentation is going to be a bit different. I'm going to share what we do in the clinical setting to combine actually some of what we have already heard, some scientific assessment, some scientific know-how with doctors' practical experience. So, as Richard said, I am the CEO and founder of Longevity Center. This is a medical center that is focusing on bringing together what the science that is today available for commercial use, validated, this is very important to us, with experience of our medical doctors. We have currently 2 clinics and planning to have a number more clinics around Europe. Richard, how can I move it? It's actually
Is it advancing?
I think I have to do the same as the first presentation. Okay, I hope this is visible.
Yeah, okay, with the mouse. Yeah.
Okay, I will do that this way. So first of all, it's very important for us to make sure that we are scientifically validated, we have the right experts behind what we do. As you can see, some of the experts are coming from the longevity field, but also we have a number of experts from psychological background and also preventive personalized medicine. What we are building as a longevity group, which is established in Luxembourg, is really an ecosystem of solutions. So we started with an institute, which is a nonprofit, and the focus of the institute is to bring together experts and really understand where the longevity field is going. But what we have seen about 5 years ago, that there was not many implementations into the real world. So there's a lot in the clinics, there is a lot of scientists talking to other scientists. But what we wanted to see is what we can actually do on day-to-day basis, and also how can we combine it with the medical knowledge. And this is what we did with the Longevity Center. And we are also planning to have a number of other aspects, but I think this is for the next presentation. In terms of our longevity clinics, we have currently 2. We have, in terms of the clients that were fully evaluated, and I will show you the assessments that we are going through. It's over 600 clients with a lot of data points. We have many more clients coming for single tests, but I will go through that a bit later. For me, it was very important that health needs to be also fun and needs to be not really typical clinical environment. So we have combined experts in the field of, medical experts with psychologists, coaches, trainers, personal trainers, but also sleep experts and nutritionists. So our clinics are focusing both on evaluation of your current state of health, of different aspects of your biological aging, with medical assessment, full medical assessment, both in terms of your body mass density, your hormonal health, the whole blood test panels, of course, but also we do microbiome, mitochondrial health, and I will go through a number of them later on. But what I wanted to show you is also what is very important, we do interventions. So we're not only doing the evaluation of where we are, but based on what we know about the client, we are setting personalized recommendations, and the client can actually go through that in our center. The second center we have in a 5-star hotel in Germany. It's a wellness hotel, which is a perfect setting for longevity, for thinking about longevity and well-being. So this is where we are focusing on also on biological aging, on different aspects of our wellness and well-being. So who is really interested in longevity clinics or in this type of approach, let's say, to our more systemic approach to our health? Most of our clients are actually at the moment women, but this is sometimes changing in time. But at the moment, we have more women than men. When you talk about longevity, a lot of people consider this is really something you do at the end of your life, which really our clients prove that is not the case. Most of our clients are around 30 to about 55. And also, most of the clients interested in this type of evaluations are primary and preventive clients. So they are interested in their health, in how can they improve, but also a lot of athletes and performance experts. So based on different examination and the areas that we focus on, we are creating our longevity center method, which combines a number of different biological ages, and I will show you which ones are we currently using. Moodoo is one of them. Actually, we are working also with Nathan and with his team. Hallmarks of aging, actually base of everything we do. So this was a very important starting point for us, actually to understand why we age, how we age, and how can we validate it, evaluate it, and what can we do to slow it down possibly. Most of our interventions are, of course, personalized, and we are looking for physical and also cognitive health. The typical client journey in Longevity Center starts with the longevity health checkup, which includes different biological ages, of course, and then based on evaluation meeting with different doctors that needs to evaluate your results, we are preparing a personalized longevity plan, which includes a number of interventions, which you can do at home or you can do it in one of our clinics. And this will be a typical checkup. So we focus on genetics, as you said. It's very important to know what your predisposition are. Of course, the family history, the predispositions that you are aware of. Very important aspect is also self-assessment by the client, so lifestyle assessment. But as we know by now, the clients are, I wouldn't say not telling the truth, but it's very colorful information we are sometimes receiving, and different doctors are receiving different information. This way, I think the data collected is very, very important. So we combine different biological ages with really a typical medical assessment. So we look at your cardiovascular age, we look at your metabolic age, cognitive, 3D body scan, posterography, very important. This is very much changing with age, the way we move and our musculoskeletal system and our body posture. And of course, now very important is the immune system assessment, but also we look at your mitochondrial health and your microbiome, which is becoming more and more known by doctors how to evaluate it. So this is the self-evaluation assessment that the clients are doing. This was prepared based on some of the validated assessments prepared by Lifestyle Medicine Association, both in the US and Europe. And then, of course, going into a more personalized way, based on the initial assessment, we go also into aspects of oxidative stress, hormonal health, various food intolerances, but this is then done based on what we already know about you and what your target is, because some people want to lose weight to start with, some people want to deal with sleep and stress aspects, and the most important thing, if we give the client too long list of things to change, they will not do anything. So we have to start with small steps. And that's why the typical journey at the Longevity Center is about 6 months, ideally 12 months, because this is when you can really see the results, especially like epigenetic clock or epigenetic age. and Nathan, you can correct me if I'm wrong, but you can't see results earlier than 6 months. So these are some of the tests that we do at home, or you can do some of them in the center. And these are some of the biological ages, and I think this is for us the most important aspect. I mean, with having a number of doctors evaluating this results, for us it's very important to have the right way to compare data. And this is our biggest challenge at the moment, and also an opportunity. We are currently working on a platform that combines all the data that we are aggregating, and it's quite a complex, challenging project, because between all the ages, that some of them have never been compared with each other, and the doctor's knowledge, there's quite of interesting data that we can base our recommendation on. This is just an example of how we look. We are not looking for a kind of one biological age. We are very complex, so we are looking really for the weakest link. And yeah, this is for example our version of Moodle. This is the white label of what Nathan was just talking about, which works actually very well. We use it in Germany, we use it in Poland. Our clients like it, and they like to come back to that. And also based on the report and recommendations, we use a lot of wearable devices for the clients to monitor their data at home. And then it's much easier for our doctors then to take them through the process and also personalize the recommendations. These are some of the programs that you can go through. So most of the clients are going through a longevity plan. Yeah, and this is something. This is actually the end of my presentation. So I look forward to receiving questions, and I'm happy also to respond to you by email if you'd like to be in contact. Thank you.
Thank you very much, Joanna. Any questions in the room? Let me stop sharing the screen first. Here we go. And yeah, questions in the room. Svetlana.
Thank you, Joanna. I'm wondering, do you have any corporate clients who come to you and say, we want to protect health of our senior executives, and we're willing to invest X amount of money to make sure they stay alive for longer?
Exactly. Yeah, this is one of our target customers. Yes, and actually, especially after COVID, I think there's more and more companies seeing the value in investing in their, especially the high employees. And looking at the health not only when something is already happening, but really to predict how can we improve the optimal performance of our managers and top managers. Mm-hmm.
What sort of response do you get from your clients on their willingness to change things? Do you, presumably because they're coming to you, they're more willing, but you talked about the overwhelm of giving them too much. What's the sweet point?
I mean, this is where we go in small steps. I mean, at the very beginning, we were very ambitious and we wanted to do everything at once. I think it's very important for the client to feel the change and then see certain differences, and then they are super motivated. As Svetlana was saying, you know, once you see some changes in your own results, then you're more motivated to go the next step. We are definitely, I mean, this is a sector that is enormously growing. I mean, every day we are getting new and new, very interesting potential contacts for new companies coming to this market that are bringing more gamification, more engagement by the clients, because I think our clients are much more demanding than before. I mean, if you want to be the benchmark for health, you have to have, you know, many different interesting solutions, because we are pretty bored with doing constant thing all the time. I mean, we don't want to have one longevity plan for life. So there's no one diet, there's no one way of doing of dealing with our lifestyle. This is why, you know, we have to be more and more engaging. Yes, please.
Pretty much like your model. my question, what I struggle to see is how to democratize access to this.
How
to democratize access to this, right? I mean, as you probably know, like this is expensive, right? I mean, probably some people afford it, but a lot of people don't. And I would be really interested to understand what's your opinion of lowering the cost of access to those, high-tech longevity.
No, I think it's an excellent question. I think we started democratizing by setting up our clinic in Poland. So, I can afford having many more doctors with super experience and actually quite a strong scientific background. But as you say, a lot of these biomarkers are still, more expensive. We are definitely going into lower and lower cost for that. For this service. I think democratization mainly would be focusing on doing more and more digital solutions. And I think, the biggest cost in everything we do is the doctor. And I think it will stay for a while.
I think that's, maybe I can follow up on that. It's a really important point that we have all of the technologies accessible to everyone on the street. You go into a pharmacy, for example, we used to get the COVID test for free, or it's still relatively low cost. How we can make it accessible, and this will have benefits to the healthcare system, in many countries, especially the NHS, because it's the value of the wellness data, preventative data as well. What are the interventions we can put in place before you hit the clinic? So I think that's a very pertinent point. What are we doing with that data? How can we analyze the data and get it to the right stakeholders to reduce national healthcare costs? In addition, using the technologies we have, the tests in the workforce, for example. You Svetlana asked about corporates that are employing these clinics or the wearables and the tests. What can we do to maintain workforce health, workforce productivity? Can this be something that the employer pays for and everyone has access to it? So these are just some of the points that I have. And of course, the insurance market as well. So one more question here.
But just as a response to that, to your last question, I'm a physician that's been doing this for about 7 years now, and seeking to how do we work out what tests are actionable? And that's, I think, the biggest question that we need to solve is, like, when we're looking after patients, what do we go after first, and personalizing to the patient in front of us, which test, which action point are we going to do first? We've sought to scale it through internal training programs. That's how I've got my scaled expertise internally. But the role of digital health to build clinical decision tools is the future of this, just like Babylon Health have done with primary care.
Yeah.
Richard, can I just add one last thing, actually in connection to today's conference? I think what is very important today, we have an consilium of doctors, which actually then analyze all the data and gives the recommendations. So what is super important for us, it's actually to digitalize it, because we want to have in every clinic that we set up the same way to recommend the client, not only based on how good the doctor is and how knowledgeable the doctor is, but so that we have a standardized version. So again, digitalization of data and know-how and knowledge is, I think, the key to progress.
And also robust academic research to validate all of these biomarkers, putting them together, getting the right algorithms, and can we make sense of it? You may use machine learning or AI, but is it sensible what you get out? Because it's rubbish in, rubbish out. So you need to collect the robust data, validated data, before you put it into your algorithms. Great. Well, thank you very much.